of 2012, my mother unfortunately suffered a stroke that left her primarily with cognitive impairment, and a lot of medical issues that happened after that were quite significant with my mother. A lot of therapy was needed, specialists were needed to be called in, and all sorts of medical issues, changes in medication, and all sorts of just transitions into a new world for her. Because I lived out of town and I was one of the people who really was going to primarily take care of her through this difficult time in her life, I was coming into town and finding it very difficult to work through the various different doctor's appointments, trying to get referrals, trying to get prior authorizations on medications, trying to coordinate the services and cares that my mother was being asked to get to, and I was just really getting frustrated and finding it really difficult to manage all this work. And so when at one of the appointments I saw something called Healthcare Home, and I picked up the brochure and I wondered, would this be something that would work for our family and our situation? It just seemed like the right type of program to help me and to help my mother get the kind of care in a seamless way to make sure that she was healthy and to make sure that the health of our family stayed together so we could focus on taking care of her. So I called the line and I got to reach somebody, her name is Linda, the care coordinator, and it was like a godsend that Linda came into our life and said, yes, this is a program that would really help your mother. So the Healthcare Home program became something that I embraced with Linda, and we worked together, and I really felt like this was a partnership, not only about my mother, but it also helped create an experience that our family felt that we were part of the team. We put together a care plan that when she goes into the doctor, somebody can look at it and go, this is what's going on with my mother. And saving that amount of time is awesome. Linda was able to just make me feel like she cared. She was very compassionate. She was really understanding about how difficult this kind of stuff can be. So she made the care become really very seamless. She made me feel like I don't have to worry that much about it. And I just think that these little details like that can make such a big difference to families. Living out of state, I could call and coordinate things with Linda right over the phone. I didn't need to necessarily be here all the time, but I knew that I was in great hands with Linda and the Healthcare Home being a part of my safety net. And not only was it for me, but it was also a great thing for my mother. I almost kind of describe it as kind of like a quilt. I mean, I think about the different patches of material that go together in a quilt. And I felt like Linda, as the care coordinator, was the person who kind of sewed the things together and made it strong and made it a blanket of safety that not only my mother, but our family really felt like we were being covered and taken care of.